We are now fortunate that there are several different measures of patient experience. The CQC inpatient survey, the cancer patient survey, the friends and family test, just to give a few examples. I think different hospitals are using data in different ways, but the enlightened ones are using all the data sources and are saying this is what the inpatient survey can tell us, this is what the cancer patient survey can tell us, this is what friends and family test can tell us. And so they're using it not as alternatives, but to say combined, they give us the true picture. I think the main way to use them to drive improvement is to have them in a readily accessible form so that people can compare themselves with their peers, so that a cancer service can be compared with a comparable cancer service, a hospital can be compared with a comparable hospital. And it's all in how you actually present the data to make that an easy thing for people to do. I hope that commissioners will be asking the same 5 questions about services as the Care Quality Commission asks. Is a service safe? Is it effective? Is it caring? Is it responsive to the needs of patients? And is it well led? They will also want to look at the financial side as well. The Cancer Patient Experience Survey can give them a lot of information, particularly about the caring and responsive domains. So yes, I would hope they would want to look at it too. Well, at organisational level, I would hope there is a leadership team for cancer looking across the different cancer types, and that one of the questions they will be asking themselves is, how good is our cancer patient experience? What they'll then be able to see is what their experience is as a whole, across all cancers, but they will also be able to look at individual cancer sites and individual stages of the cancer journey, and they'll really be able to say, this is where we need to make improvements. Well, I think there's a variety of ways in which we need to mobilise people on survey data. Some people will be motivated simply because it's the right thing to do. Some will be motivated because the CQC will be inspecting and they will want to have a good or outstanding result. And we will be using patient experience survey data of different forms to help us make our judgments on one of our 5 key questions, which is a service caring? All survey data only tells us what the survey questions focus on. I think trusts will at that point want to say, okay, if we're having a particular problem, let's say with the ward level care, what's going on the individual wards? What wards are these patients being looked after on? And let's look at that in more detail. Or what's happening in outpatients. So the survey data are not an endpoint in themselves. They're very valuable, but they should also prompt people to ask more detailed, deep dive questions as well. Patients and carers are absolutely vital allies in helping us to both measure patient experience and then improve patient experience. They are the ones who know what's happening. It's their lived experience that we need to be able to measure. It's their lived experience that we need to be able to improve. We must go on measuring. Unless we measure, how will we know whether we're doing better? And how will we have the tools to use for improvement? Because we won't know exactly what it is we need to improve. We need to listen to patients, but through surveys are one of the ways that we can listen to the voice of the patient.